Hi, I'm Dr. Joy Chang, an adult gastroenterologist from the University of Michigan here in the United States. Thank you to ausEE for inviting me to be part of this fantastic series, and happy National Eosinophilic Week. Today, I'd like to share with you my passion for improving patient-centered care with shared decision-making and how it plays into my practice in EoE. Today, I hope to define what shared decision-making is and what its benefits are, review the key elements of shared decision-making, see how we can plug it in the practice of EoE, and then introduce ways for you to engage in shared decision-making. And if you're like me, many of you spend a lot of time thinking about how to make the best decisions in life and decisions that might impact your life and not just should I eat this cookie or not, or should I watch this show. And here's the thing, making the best decision in life isn't always concrete black or white with a clear wrong or right answer. And the best decision is generally an informed one, and we'll talk more about what that means. And finally, the best decision really involves expertise, really help from someone who may know a little bit better about the disease or making a similar choice, and certainly your own lived experiences. In making the best decisions in healthcare, same rules apply. So because healthcare choices are rarely one size fits all and often complicated by many things like other medical issues, finances, access to care, and the people around us. So as a result, healthcare decisions are not often concrete, nor are they easy. And the best healthcare decision is an informed one, and studies show that people do want to take part in their own decision making about their health. And then finally, best decisions often involve expertise from at least two sources to make the best recommendation. You got to take into account the opinions at least two experts, and then that can be the doctor, your physician, your care team, as well as patients. So the expert, you yourself. Patients know what is most important to them, what you can tolerate, and with the uncertainty and symptoms that you can deal with. So what do I need to know to make complex decisions about health? Well, we have data about the likelihood of risks and benefits. So what are the chances that I suffer from an uncommon side effect? What are the chances that my symptoms resolve? The level of certainty about certain outcomes. So will this treatment completely resolve my symptoms, or will the symptoms just get less intense? How much time should I expect this to happen? Familiarity with the health issue. So how much do I even know about this condition? Which often plays into like information sources. So where can I get more information if I need to? My beliefs and values. So at the core, what is important to me as a person? And social networks. So because we don't live in isolation, how does this affect those around me and from those who are on my team supporting my decision? Family, friends, loved ones, peer supports. And then finally, past experiences, my own experiences as a patient, but also the shared experiences of those people who support me. So I want to introduce the idea of preference-sensitive choices, or when there is more than one appropriate choice. And in making preference-sensitive choices, patients agree on what is best for them and how they value the benefits of the harms of the different options. And ultimately, the decision is made based on beliefs about response, risk perception, severity of disease, tolerance of symptoms, and education from either your clinician, your doctors, your peers, the media, taking all these things together. Now, these choices are the most appropriate, so preference-sensitive choices are the most appropriate in situations for shared decision-making, and that's when we're uncertain about what is the best absolute choice. So shared decision-making broadly is this process where clinicians and patients work together to decide about interventions or tests based on what the clinical evidence is out there, and then the patient's informed preferences. Shared decision-making is known to improve healthcare communication, patient participation in their own care decisions, uptake and adherence to treatment, and also treatment satisfaction. So the perfect situation for shared decision-making is when one choice isn't superior to another. And good shared decision-making requires that clinicians not only have access to detailed knowledge and the latest evidence, but also have a means of sharing it to patients and people they're caring for. The evidence is that patients do want to take part in decision making. Unfortunately, many clinicians think that we're practicing shared decision making, but the evidence shows that there might be some gap between the perception and reality. So they think they're doing it, but that may not be happening all the time. So I think about shared decision making as these three parts, right? So the delivery of knowledge. So this is the numbers, the effectiveness of these treatment options, potential benefits and harms. Patients thinking about their own values and preferences and then communicating it to their care team. And then finally, together, the patient and the clinician have hashing out together, developing a care plan. So shared decision making is often viewed as a hallmark of good and ethical clinical practice, and we all think, yes, all doctors should practice shared decision making, but it would always so challenge you to think of it as a way of enhancing your own engagement and activation as a patient. So in other words, practicing shared decision making as a patient is also a way to empower yourself to take ownership over your own health journey in order to maximize positive outcomes or improve your experiences in care. Right, so it really is a partnership, and so we're really relying on you to come to the table as well. Shared decision making definitely puts you at the center of your care, so your goals and your preferences do matter, and it helps you to understand the treatment options more clearly. It makes it easier to talk more openly with your care team and leads to choices that fit better with your life and what's important to you. And so shared decision making can definitely give you the confidence in the plan and that you and your doctor decide on. And so we have here many benefits of shared decision making. Like I said, increased knowledge and clarity about those options, those goals. It increases, your participation, definitely the communication between you and your doctor. And then also kind of on a bigger scheme in terms of, decision making, it can improve, treatment uptake and sticking to the adherence, your satisfaction, decreases, conflict or uncertainty about making decisions, and may or may not have a role in your decision regret. So I regret making this decision later. So effective shared decision making is actually a two-way flow of information, which the patient shares his or her personal values, goals, preferences, and circumstances, and the provider presents this unbiased view of all the different options. So together, the clinician and the patient evaluate all that shared information to decide what treatment option best aligns with the patient's needs and values. And I always remember that the shared decision making is not necessarily a one-time event. You don't just do it and be done with it. And depending on the decision you have to make, the process might take a few minutes, a few hours, or even several weeks. It's an ongoing dialogue, really. So when can I practice shared decision making? Like I said, shared decision making is a perfect situation in preference-sensitive situations. Not shared decision making is not appropriate all the time, right? So when there is clearly one best medical treatment, like should you use an antibiotic to treat a life-threatening disease or infection, there's not equal choices. Either do this or not and get very sick. So shared decision making should take place when there's more than one good option. And this includes new diagnoses, a change in your disease or health status, potentially entering a clinical trial, various screening tests, or when your life changes change. And since it's National Eosinophilic Week, let's think about all this in the context of EoE. So life is full of choices, and so is EoE. And sometimes that's a good problem, but also sometimes it causes a lot of confusion. So when we go to talk about treating EoE, we have so many different choices. We have medications like proton pump inhibitors, swallow topical steroids. We have biologics such as dupilumab. We have endoscopic dilation, so stretching of the esophagus. We also have a whole host of dietary therapies. Are we avoiding one food versus 6 food? And so many of these different options we have. So what is the ideal management strategy? And this is a little bit of a trick question because medications or dietary therapies can be recommended as first-line treatments. Like I mentioned, proton pump inhibitors, topical steroids, we have dietary therapies, and then in certain situations, biologics like dupilumab. And why is that? We actually don't have the evidence to tell us what is the number one best treatment in all situations. And so there are no studies comparing the efficacy of medications versus diets. There's only a few studies comparing medications against each other. So there's a lack of head-to-head comparison to tell us, again, which one is number one or the best in every situation. So shared decision making sounds great and all, but how do we do it, or how do we engage in it, or at least certain parts of it? And so I want to highlight these different elements of shared decision making, and let's kind of apply it to EoE. So let's walk through an example here. So here's a real life example. So first we want to define or explain the problem of EoE. And so a 63-year-old man with eosinophilic esophagitis, or EoE, comes to my clinic. His symptoms are largely food getting hung up, or kind of the sensation that food drags or spends a little bit too much time going down. He also tells me he's got some throat discomfort, and it's been going on for about 15 years. He recalls being diagnosed with EoE about 10 years ago, never got any treatment though. So the problem here is that he has persistent symptoms for several years now, and since he never got treated, he has untreated and uncontrolled EoE. So next we want to present the different options, right? So in EoE, we have several different options. And so we would discuss things like medications, like proton pump inhibitors, the pills, medications like swallowed topical steroids, injectable medications like a biologic dupilumab, also dietary therapy. What does that look like? On a day-to-day basis, what are the different forms of empiric dietary therapy? We can talk about dilation or stretching of the esophagus done at the time of endoscopy and as necessary, and then also doing nothing, or what I call wait and see. Right, he has actually been waiting and seeing for about at least 10 years since he was diagnosed with EoE with no treatment. So these are all his realistic options. So next we want to talk about the pros and cons. So the benefits, risks, the different costs of all these different therapies. And as we know, there are so many different trade-offs. So benefits of using, for example, a medication versus, avoiding certain types of foods. There are definitely pluses and minuses to all of those options. And what are those risks? And does it come with a financial cost? Does it come with a lifestyle cost? So juggling and kind of spending a lot of time talking about the trade-offs. These are good things. These are bad things that can happen depending on which treatment option we elect. Next, we want to delve into the patient's values and their own preferences. So we asked this patient, and he tells us that eating his favorite foods without any limitations is probably the number one most important thing in his life, right? He says, I'm a foodie, I like to go out, I don't like to think about what's in my food or restrict my diet. Overall, he's pretty willing to try medications. He's a little hesitant to use steroids long term, and the word steroid just gives him a bad feel. But he feels pretty neutral about needing to do endoscopies if necessary, so he's okay with that. Next, we want to discuss the patient's ability or really self-efficacy. And self-efficacy, I like to think of is your own individual belief about your ability. So based on feelings of confidence or control of the situation. So your own ability to implement a behavior or change a type of outcome. And so in other words, we think, what is my ability for getting this done? And here our patient will tell us that, sticking to a restrictive diet is really not possible. He says, I just know myself, I will not be able to stick to it. It's a non-start. He's pretty confident that if given the option, he could remember to take a medication once or twice daily, he can set a timer on his phone. But in terms of like the biologics or medications that require injections, he's super fearful of needles, and that's absolutely not his first choice. It's just not mentally there yet. And with his work and his lifestyle, he's able to schedule endoscopies if they have to get done. He can make it happen. So next, the doctor's knowledge recommendations. So here I come in to integrate my knowledge into what I'm hearing from the patient. So I would say, okay, hey, it sounds like the elimination diet, so removing dairy, animal milk, wheat, eggs, soy, potentially, or even more, doesn't necessarily sound like it's in line with your preferences. You don't really want to take foods out, and that's okay. In terms of medications, we have a fair shot at success with proton pump inhibitors. They tend to be effective in about half of people with EoE. There are potential risks and benefits of proton pump inhibitors. We talk about what those might be or what those might not be. And if topical steroids and dupilumab might be our backup options, right? So not too excited about those, but if we have to go to that, what are the risks and the benefits of those? And then the timing of the next endoscopy. So when are we going to, what are the next steps? We take this medication for some time, and then when are we going to look? How many endoscopies do we need? So next, we want to check in and clarify understanding about those options, right? So clarifying all the different treatment options we talked about, including not doing anything. And sometimes we call this a teach back. So it's kind of a test like, tell me how you're understanding what we just talked about. So our patient says, okay, I think my medication options are proton pump inhibitors like omeprazole, topical steroids that are swallowed, sometimes in inhalers, sometimes in some gooey sauce, sometimes it's already in the package, and then injectable medications like dupilumab, where I may need a little bit of help with this. Now, it sounds like I need a scope to make sure the treatment's working eventually. But do you think this means I have acid reflux? What are the chances that each of these treatments doesn't work on me? And what does it mean if I need dilation or scar tissue? What happens then? And I would respond and come and say, these are really great questions and go through one by one answering all of them to make sure that we're very comfortable with all the different options and understanding of the options. So at this point, this is when we start thinking about making or even defer the decision. So I say, it sounds like you're leaning towards trying a proton pump inhibitor first. And he says, yeah, I guess that sounds like the easiest and maybe safest bet, but I'm still not totally sure. So I say, how about discussing these options with your families and friends, whoever you trust more, or even just going home and mulling over it a little bit more. You don't have to decide today here in this room immediately. And so he says, sure, yeah, I will see what my wife thinks or what my parents or my friends think and get back to you on this. And that's okay in terms of making a decision. You don't have to make it right then and there or feel pressured to. But especially if we don't make a decision right then and there, it's important to arrange some follow-up. So I would say, okay, so if you haven't decided today, that's fine. Let's plan to make a check-in in about a month. Shoot me a message, call, or we can have a clinic appointment. But if you happen to decide sooner, do let me know. We can start that treatment. If any questions or concerns come up, please do ask. Right? We want to be good sources of information for patients. And we won't make any plans unless you're totally comfortable with them, right? If you don't want to do a certain therapy, we're not going to force you to do it. So people often ask me, what happens? How do you handle situations where you and the doctor simply don't agree? So this conflict of medical decision making. I just really want to urge you, that you are your own best medical advocate. It's so important to get the facts and also consider your own needs, values, and what you hope for is the best possible outcome. So what you may value as the best possible outcome might not be the same as what I think it is for you. Remember that you're not alone. I think what's the beauty of being part of patient advocacy groups is that you can seek out help from other patients, friends, or family. Definitely, you're not alone in the EoE journey. And then actively listening. So being prepared for appointments with a list of questions that you want to ask your doctor, taking notes, or really bringing someone who can take notes and remember things. And if something doesn't make sense, ask again. Ask again for clarification. And then communicate what you care about and take time to decide, right? It's really your life. And this is a disease, EoE is a disease that is chronic. It's going to be with you for a very long time. And so taking the time to be thoughtful about your decision, knowing that you can change your mind later too, is important. And so we as clinicians often assume that patients speak up, that if, you speak up if you disagree, but that's not always the case. And so again, being part of that decision-making process is knowing it's okay and it's appropriate to disagree or even just ask for more time or more clarification. So to review, shared decision-making requires clinicians to offer unbiased, latest evidence-based knowledge, patients to clarify their values and preferences, and open communication between the both. Since that third component of shared decision-making is communication, I want to kind of bring up, how do you even broach the topic of shared decision-making with your doctor? And so I would urge you to set an agenda, like what questions and concerns you may have and you want to prioritize with your clinician. So these may pop up as you talk to them, or they might pop up before the visit. Just write them down. Express your understanding of the condition or what you've been told. It's always so important to us to know that you get what we're saying, that we're talking about the same thing. Let your clinician or provider know that you want to be involved in decision making. Sometimes we don't always know that, and sometimes people will say, oh, well, just tell me what to do. But if you want to be involved and you have something you feel strongly about, please speak up. And then finally, do share what concerns and worries you about your EoE. What do you want out of the different treatments and options? There are so many different trade-offs and pluses and minuses. Tell me what you already know about the treatments and the options, and we can kind of hopefully course correct or just demystify any myths if there are any, and then what concerns do you have about risks? Like in our case, our patient was not so awesome, doesn't feel so awesome about needles or steroids, because the word steroids, and we can certainly talk about, are those risks real risks? Are they small risks? Are they big risks? And what does that mean for you? And finally, I want to close by saying there is absolutely a space for shared decision making in EoE care, where there is definitely more than one absolute right treatment. It's important for us to recognize and address patient priorities and engaging in shared decision making in order to really paint successful management of EoE. What defines the best treatment may depend on several medical and non-medical factors. And so, sometimes we come in with our scopes and our pathology and we have something to say, but you telling us what is important in your life is also really important. And then finally, don't be afraid to speak up. Shared decision making really only works the best if you're involved. So with that, I'll close. Thank you and be well. Happy National Eosinophilic Week, everyone.